So, journal, journal number 3, something like that. Journal number 3, something like that. I don't know. So, basic plan. I need to write down. I've been having trouble with my sleep. Yeah, I need to kind of focus on getting a general sleep schedule again going, forcing myself up to wake up at specific times and even during the weekends. Try and make sure to take my night medication and have a general sleep routine for specific days. You guys are way too far away to be able to hear me. Oh yeah. Should I have this over here? Should have, didn't. Anyways, yeah, I need to get a basic sleep regimen thing going. That shouldn't be too difficult. People that have trouble doing things in general tend to have to write it down. I don't know, I just sort of get to a certain degree where I just sort of start doing things naturally. I already used to do them, and I know that they work and all that, and it feels almost like the negative energy and everything else that's stopping me from doing them is going away and allowing me to do it. So I'm kind of hoping to have something close or similar or whatever happen with psychedelics and basic behavioral health treatment with, I kind of want to start introducing some EMDR beyond the cognitive behavioral therapy. CBT is, it's really what it is. It's because in reality you have to constantly be thinking of something before you're thinking of something. It just doesn't really work. It's best to start implementing techniques to help it work. It doesn't itself work itself. It needs its own techniques to be able to manage it, to be able to make it somewhat effective. Typically, realize nobody controls their emotions, nobody controls their thoughts, and nobody controls anything really beyond any of those two things. You definitely can control your actions, because your thoughts and reactions can be taught to be suppressed to a degree. And by that I mean not as explosive, or if it is explosive, not allowing it to go so far that you don't start to, calm down, and these are the techniques that you have to learn, because you're going to have immediate reactions after the fact. After those immediate emotional or whatever reactions, that's where implementing a lot of these techniques, cognitive behavioral techniques, catching yourself basically, is the primary solution to things. It's hard as fuck to do, and ultimately you have to constantly, it has to become a habit. It is not easy. You have to build it up in your head. It's not a simple switch I'll just start doing this. You've been thinking a specific way for a very long period of time. You're used to thinking it that way, and you're used to acting upon those thoughts, and you're used to reacting a specific way. So right now what you're actually doing is essentially retraining your brain and fighting it yourself, essentially, before you do something. It's difficult. It's very difficult, because for some people, especially people with significant mental health issues, they have a very short time frame of reaction to action. It's very short, and it can be shortened or lengthened depending on a person's emotional state and other various factors. So it's not easy. It takes ultimately it takes a lot of experience, meaning you have to go and constantly get triggered in doing it over and over and over again before you can actually start it, having it become a habit. So essentially, this technique is a technique that you will be having to master while being around loved ones and everything else, and having all those triggers come back. So what you're essentially trying to do is very, very, very difficult. It's not easy, and everybody's going to want to poo-poo on the overall speed at which it's happening. Meaning, it's, why didn't you just immediately change? Why can't you just immediately do this? But in reality, nothing is usually that immediate. I'm not saying it can't happen, just, it's difficult. When it usually happens immediately, it's because the person is consciously aware of doing it, and usually don't really care about doing it one way or another. And so it's usually easy for them. As soon as they have an emotional investment attached to whatever action or inaction they are doing, it becomes much more difficult to change this behavior, because there's a emotional reinforcement to it. And that takes a lot longer as well to change, because ultimately, if you've been hurt mentally, you have a high likelihood of less overall mass or connections within the area that deals with emotional trauma and behavioral control, prefrontal cortex and amygdala, I believe. If done at an early age, it could possibly present itself as aggressiveness and ADHD, with, I'm guessing, ODD. So, just something to watch out for. Sometimes people are not always, it's not always as simple as you think. Especially when negative neural pathways and reinforced actions in the brain have been done for most of their life. It takes a very long time to change. Change behavioral patterns and neural thoughts and stuff like that. It's not easy to begin with, and the average person has an easier time than one who has grown up with it. It's just your brains are built differently. It's going to be easier. It's just that way. As far as we're aware. Anyways, I don't know. I was just thinking about everything that's going to be going down. I really want this to go well. I can't get a testing kit, but I can be safe about this and do a very small allergy dose, which is apparently what you're supposed to do. Very, very small allergy dose to see if you are allergic to the medication and just see what the effects are. So I figured I'd be very careful, but try and get like a small dosage that I may or may not feel something, but also there should be enough for in case of that. But see, then you don't actually know whether or not it's the effect of the drug or if it's an allergy. So I'm thinking extremely small, does not actually affect mentally, but could potentially cause whatever allergic reaction. Unfortunately, the scale doesn't go down that low. So, it's going to be a bit difficult. Most likely, I'm going to be kind of guesstimating with stuff. My plan was a small little, very small amount on the tip of my pinky, not covering the pinky or anything like that. It's a very, very small amount or using a clothespin of some sort, and having a whatever amount rest upon about a millimeter, and isn't too high on the head of the pen, and putting that underneath my tongue, seeing how that affects me allergically or anything like that. I don't know. After that, then it's gonna be waiting 3 days, 3 to however many days until weekend comes around, and then it's early morning. I have a preparation state, put myself in a good mindset, wake up well in the morning, do some basic routine, talk to myself before this occurs, write down either talking to this and have a date and time said aloud, as well as maybe writing down on Google Documents what is going on, for how I feel, what my reaction is going into this, and of course the actual plan while this is going on, or plan of action while this is going on for set and setting. You want to go out, kitty? Give me a second. Okay, so turns out Cat was actually not even inside here. If you could hear that, it was through the fucking door. That door is goddamn thin. It's very thin. Anyways, what was I talking about? Alright, plan of action for moving forward. So, I don't remember where I was, but yes, so just I'm gonna more than likely be taking around 20 milligrams, 25 milligrams, something like that for my first trip. That's the median dose. It is going to be within the powder is going to be going into a teacup. The teacup will be given lemon and lime juice for the citric acid to be able to turn the psilocybin or whatever, psilocin, whatever, into psilocin, or basically the more active ingredient that it usually gets broken down to in the body. I will be swirling it for a while in my mouth, and then I'll ingest the rest of the liquid. Give it a swirl again, adjust the rest of that liquid, and this will most likely be me in the backyard at this point doing this, because I expect the onset of the effects to be quite quick. If not, I can still be out there, but basically as soon as I feel the onsets of any effects, then I will be going into my room. I will most likely already be playing the playlist I plan on having. I have not decided which one. There's one of two. It's a 50-50 toss-up. I might change it during this is going on. However, I don't think that would be wise, because I would prefer a consistent experience. But yes, most likely the playlist will either be the psilocybin playlist as curated by the Johns Hopkins and Harvard team, or I will be going with the self-hypnosis playlist that I have already curated for myself to listen to at night, that I have felt very good results from when I wake up in the morning. I plan on having in my room, being underneath my covers, turning off my computer, using my phone to be doing this, listening to everything, while also using Sound Recorder. While I'm underneath the covers, I will be using a very slow speed of the fan, while also having a small light projector that will display colorful lights in a fairly random pattern for me to gaze at the roof, to put proper set and mood into motion. I will document my experiences as best I can while stuff is going on through Sound Recorder. If I will have something nearby to write, but I will see how that goes. During trip, try my best to guide myself in a proper way. There are some YouTube guides for meditation that are good for certain things that I could put on repeat. That is also another plan, but I feel like I will decide what I feel is best once everything is sitting down and there. That's typically how it goes. What I feel most comfortable with is what I want to do. Therefore, I will make sure I'm most comfortable with whatever it is I decide to choose on that time. At that time, I'll just have what I need readily available for me once I go into this experience. Afterwards, I will record my results as best I can, and both short, medium, and long. I want to test to see what my overall mental well-being it feels like. Short term afterwards, long, medium term, meaning a few days afterwards, or short term, like extreme short term, medium term, and yeah. So extreme short term right after, to a few hours after. Short term, a few days to maybe the end of the week. Then medium term, probably half month, so 2 weeks to a month, and then then probably like a few months, 3 months, I want to say, to 6 months. It's some medium long term, and then longer than that as well. I will have to schedule these on my Google Calendar each time I have an experience. This will be the procedure. I plan on having 2 weeks in between experiences. This could change. It could be up to a month, longer. I will not be going shorter than 1 week. It's not going to happen. It's a bad idea. It's just a bad idea. So, moving forward through that, so yes, the shortest would be 2 weeks. I would actually be recording, okay, so this is how I feel, how I feel about my last experience going into this experience, and so on and so forth, most likely. And I will actually count 2 weeks from that, because my plan is every 2 weeks, and then do that and do my standard 1 to 2, 3 days. So there will be a large amount of data, hopefully, to pull from for me if I can keep myself on the habit. I need to properly schedule these in, remind myself to do them at specific times, and to proceed with caution. And be aware it's not permanent. It can help. And to just let it happen for it. I currently have, if I were to stick with the 20 to 25 dose, just say 25 milligram, just for ease of math. If it's 25, I have 500 milligrams, 25 milligrams. It would be in total about, I've done this before, I don't know why, but I guess because I'm recording. So 2 for every 50, so to get to 500, so times 100, so 200, 20 doses, yes. It doesn't matter how I get to the number, as long as it's the right number. It's not necessarily true. I actually kind of remembered mid-sentence, oh yeah, I did the thing, it's just 20 doses, basically. Spread out over 2 weeks each, would be, quite a few fucking many times. Like, that's quite a few times. That's no joke. So yeah. And there is the possibility of increasing dosage as time goes on. Not frequency, but dosage. To see, as I get better acquainted, if going further would help. Now, this is to be determined. It is only a possibility of something that may or may not happen. The increase in dosage would be for if things were going well and I was able to start achieving higher clarity involving my own personal past and traumas and how I'm my own worst enemy and everything else. If it allows me to just change a few things, but it allows me to start viewing the inside of me and so on, then I feel like the benefit can be immense. Consistency would be good if it were a trial. However, I'm also an experimenter, so the consistent dosage might be that, but every so often it might get increased for more directed or increased under the expectation, the hypothesis, really, that it will increase the ability for me to properly self-diagnose in words. There's a possibility that the immediate aftermath of taking dose, the increased dose, it will lead to me being the opposite of wanting to do more of that, or seeing that, it's not a good idea, therefore we won't I have to pause this. Alright. So, I got a little stuck on something I wrote in Reddit. But, anyways. Where was I? Alright, that's the basic plan for the psychedelic treatment. In terms of what's going to be going on while it's happening. The aftermath, in terms of some of what I'll be doing after I've responded. Some of the other stuff is I'll be both presenting these journals. I'll be hopefully writing down the basic synopsis of what's going on, best I can, and whatever it happens to bring up, and the feelings and everything else will be talked about and discussed with my therapist, and my psychiatrist just kind of needs to know what my dosage is and my overall feelings. They don't really need to go over, with what it would mean, you know what I mean? So I plan on giving them the basic printout of the synopsis of what happened, and I'll be going and talking to them hopefully once a month. I'm not sure anything more than that. I have to get an appointment with them to be able to go over and properly do this. Those are my two, in terms of professionals, psychedelic or otherwise. They are those two. I'll be going over with them everything that's going on. I hope to get my primary care talked to about this as well. They will get a synopsis of what my psychiatrist gets, so dosage and feelings, synopsis. I do want to get a basic physical done before this occurs, while treatment is going on, and while treatment is going on for a while, then as well as a basic follow-up, blood results, stuff like that, after I've decided to stop treatment, if that occurs. That way I have both body and mind, physically the mind taken care of, in terms of, if my body is going to have any issues with severe low blood pressure or anything else like that. Now, granted, there are things that could happen during this, but the dosage shouldn't be that significant to the point where it could start causing some of those issues. I'm not saying it's impossible, or even that it will or will not cause any side effects, just that they are unlikely to be significant enough to cause other damage, as I am a fairly healthy individual, but I do need to get things checked out. But however, they are not related to strokes, possibility of strokes, or my heart stopping. They are mostly related to things to do with, well, actually I don't really know. I believe they aren't, however I don't know. It's possible that if certain things are there, that they could cause these issues. I was on certain antibiotics that are known now, newly found out, to hurt nerves, and as well as cause damage to the heart. So I want to get that checked out, and I want to make sure that the possibility of it doing anything, however slight, is minimalized, if it is there, and if it isn't just damage to the nerves that go to the heart and how I feel it, which could have been the possibility. It could also be that that's not the possibility, so I don't know. I just want to find out what is actually happening. That's all. Now, as for anything else regarding the physical side of things, that's about it. Be getting physical therapy done during this. I want to continue that into working in other ways beyond just going to the physical therapist. I want to make sure to also start doing the exercises and treatment things that they get me, that they wish for me to do at home, like I did previously. So I want to start that up, and I also want to start instituting my own diet and workout plan. Hopefully I can meet with a nutritionist and a basic obstetrician for helping with muscle and bone movement, as I believe some of my bones are probably significantly out of place as a result of certain muscle issues. If it's usually multiple different issues for me. I have both knots and scar tissue, as well as a weakening of certain muscles and an strengthening as a overcompensation method of others, which pulls on bones and skeletal structures in incorrect ways and causes its own trouble with nerve damage, basically, and inflammation and other problems. So, I wish to rectify that and be able to appropriately have my musculoskeletal system put into the correct way, essentially. Don't know a good way of putting it, but making sure everything's as good as it can be in terms of where it needs to be, and massaged, and for those knots, and stretched for those underutilized muscles that get pulled in and then built up with the physical therapist, hopefully, and along with diet and exercise. I'm hoping that will significantly that will hopefully significantly change the pain profile that I have for my body. If it doesn't, and it turns out that I am continuing to suffer because my nerve problems have progressed. They started out small and in specific areas and have grown into other areas, which has me worried. And so I want to get that checked out. I don't think it would be a neurologist thing if I'm honest. They do deal with nerve problems, but I'm not sure if it's immunological in nature or if it is simply a significant amount of mental stress and self-damage over time, resulting in these problems that I have occurring. I do believe that I was on a supplement regimen that increased the central nervous damage that I had going on, with neurotoxic properties. And then on top of that, I started to get put on to a antibiotic that is known to harm nerves, and damage the heart. And I was on that for about 2 weeks. And then I got put on to a fairly aggressively high dose too, along with later on the next year. Actually, no, I got put onto another dose after that too, for a while, I believe. And then I put on something else for, I believe, an respiratory infection. I'm not sure on that one. It's that one's fuzzy. But yeah, definitely most recently, as in this year, got put onto another antibiotic that is directly labeled on the article for 30 days. Again, a very high dose. And it did seem to damage my heart, because some of the side effects that they were listing for you to go to the hospital right away, I experienced. Obviously, I'm still alive, and I didn't have any issues, which leads me to believe that I might have just suffered some small damage, or I might have just been hurting the nerves that were already damaged around my heart. In either case, I would like it to get checked out, along with the, I think, acute bronchitis that I have. Because I've been coughing up white phlegm for a good while now, good 2 weeks now. It started off as a basic cough, and then it turned into white phlegm. Didn't change color. It still hasn't changed color. Do not want to get on to any antibiotics unless it gets really bad. It's just ridiculous. It really is. It's super ridiculous. Because both upper respiratory infection and UTI antibiotics are implicated in this. So it could have been that I went back on to these antibiotics that might have caused even more damage. So I'll make sure to, if they do recommend anything, to not take it unless needed, unless it's an antiviral, in which case I might, but it's different. It's not antibacterial. It's that those are I didn't see any antiviral FDA warnings for those, but those have their own issues that are known, and I'm sure they'll take that into account. But yeah, I want to get it checked out. I want to get the lump checked out in my throat that I've had. I think my doctor and I thought that it might have been TMJ or something else. It could have instead been this lump that started and grew and has since gone down a little bit to be a sort of overfilled salivary gland or something like that. A muscle knot that is slowly working its way out, or something else entirely, I don't know, but I need to get it checked out. So I need to get an x-ray of my chest and abdomen, echocardiogram or something like that for my aorta. Get that done. See the obstetrician or whatever it is for setting my bones and musculoskeletal system into the right way as I continue to go through physical therapy and diet and exercise. Hopefully, if I can get a nutritionist, which I doubt, but if I am, I would be able to add on top of that diet a proper diet that I could follow fairly well, hopefully. That would be a good plan on top of the mental health treatment that I hope to be included in, or I will be going through. So I think that these things combined together will hopefully give me a very good chance of succeeding in changing my behavioral health patterns. And the overall future I feel that I have for myself. If I'm able to do this and able to get better mentally, able to at least somewhat physically get better, and should I find any issues, because I also want to get a biopsy of the lump that I have in my fucking chest. It needs to get biopsied. It's annoying me. It's gone up and down. I know it could be breast tissue. It's going to put my mind at ease to get it biopsied. So yeah, I want that done. I want to get a study done on my lymph nodes. I have had some random weird lumps on my body that could be related to basic muscle knots in certain areas. In other areas, I don't think so, because I've had them in my thigh area and in my stomach area, and in the right side. There's been a lump before. And so I really would like to know if I have some sort of an increased something wrong. I need to get it, basically some sort of inflammation, some sort of weird movement to my organs, something that happened. Whatever it is needs to get fixed. I know something has happened, because I've had the consistency of that pain for the past 2 years. Something's there, I need to get it fixed. Now, as for a lot of my physical knee, hip, lower back, and ankle and arc pain and stuff like that, a lot of that's down to me being the weight that I am, re-aggravating old wounds, and not having the muscles to support that new weight, I feel. So hopefully diet and exercise will really help those pains out even more, alongside the lion's mane mushroom that helps out nerves and the myelin sheath that is attached to it. I have noticed already, since taking it for 2 weeks now, 2.5 weeks, some small changes in terms of my ability to control facial muscles, pelvic floor and lower abdominal muscles again. My back muscles have feeling again, along with control. I can start moving some of them again. There have been numerous changes in terms of actually feeling pressure, temperature, stuff like that again, which is nominal, phenomenal, abnominal. So yes, I do think that it is helping tremendously. I do also believe that there, as a result, is nerve damage throughout my body. I believe I caused it. I believe it needs to be figured out where it came from, figure out what the source is, if it is immunological, autoimmune, basically, or if it was a attack from my body being overreactive to a foreign invader, if it was self-damage through those musculoskeletal systems, something else, something else, something else. So the basic plan for the physical thing is to target what I can to eliminate what it could be. Targeting diet, exercise, and overall musculoskeletal system allows for treatment with a supplementation of lion's mane mushroom along with other supplements to decrease inflammation, namely turmeric, cannabis, CBD, THC, and other cannabinoids, coffee, and a few other things. It has seemingly helped start the beginnings of what to do. I believe in this. I believe the psilocybin that will ultimately be given to me will facilitate growth of new nerve endings in the brain, which should help further increase the strengthening of neural pathways to help with these pain signals, these emotional pain signals, and trouble passing information from the prefrontal cortex to the empathetic amygdala and hypothalamus to further self-treatment, basically. I don't really know how to pronounce it or say how, but basically allow for it to hopefully this treatment plan to facilitate a change, a drastic, significant, long-term change. And hopefully I stick to the schedule. I'm hoping to use this schedule as a way to hold myself accountable. Because if I slack off and I don't start treating this the right way, I'm afraid that I will go the route of cannabis, in which cannabis is great and can definitely be used as a wonderful treatment method. And in fact is pretty good in combination with psychedelics, I've found, from anecdotal research. However, I also am very well aware that it is a relaxer, a first piece of the puzzle for some of us. The main reason why I say that is because what it will do initially for some of us that have really badly severe, some, not all, but badly severe, deep-rooted PTSD or trauma from childhood that we can no longer access in our memories, it will start to make us look inward. Marijuana and cannabis, which are the two same things. But yeah, the plant itself, maybe not. It depends. You'll have to find the strain and everything else, and how different strains and cannabinoids and terpenes, temperature, smoked or vaped or ingested, temperature that were used to and maybe terpene cannabinoids that were trying to be added after the fact. There's so many different things to it. It's very, very complex, and everybody's body is different. So, yeah, ultimately speaking, it can do this to some individuals who have this issue. It's just so niche of what I'm saying in the first place. However, I believe that for these niche individuals that do get this profile, everything lines up and all that, it makes them look inward, further into themselves, and it starts to open up some of that pain because they're not as afraid anymore of it. Because it starts with their body. Their body is no longer in pain, and they can sometimes still feel it, but they won't be as afraid of it. They won't be as focused on it. And what that does is it teaches the brain to not be as afraid of the mental pain that you have. Therefore, opening up those channels and allowing for your brain to start to try and explore some of those things. Initially, it's going to be day-to-day stuff. Oh my God, I can't believe this person did this, or this person said this, or she, or whatever it is. And then you're going to look into it introspectively. Well, what's their perspective? What's this perspective? How do I feel? How would they feel? And so on. They're going to ponder. And as they continue pondering, as they continue focusing inwards, hopefully some meditation occurs. Hopefully some, better understanding about themselves and the world around them occurs, and some more mental focus on the present, being more mindful and having more mindfulness about them occurs. And then, unfortunately, this is the thing, if they're like me, if they didn't know what they were doing, they just knew you could meditate and do this, and you can explore all how you want, all on your own, with no guide, and no idea what the idea of an ego death is outside of people on the television and saying that it's the world's worst thing that could happen to you, and it's a really extreme thing that happens only in psychedelics and these other very sick-minded people. Well, turns out it's really not that uncommon for these individuals that do not understand this, like myself, getting into it. They are somehow able to achieve that level. They're not ready. You are not ready for it. And it can reinforce negative thought patterns and increase empathy towards oneself, but decrease empathy towards everything other than yourself, thus leading to a narcissistic personality trait. Now, it's not ideal. I've learned some of this stuff recently, and I'm not saying it's impossible for me to go back to that point. However, what I have realized in doing this is that I didn't understand what was going on, or was even ready for it while it was happening. And now I believe I've got a slightly better understanding of where I should aim myself towards, and how I should try and explore myself mentally. Unfortunately, as a result of the massive fear response that comes from ego death and other things, and you suddenly experience through doing this, can cause, I think, psychotic breaks if you're doing what I was doing, which was that alongside certain supplements that were maybe causing central nervous problems, an overactive immune system. There was just a lot that went into that whole experience, and ultimately speaking, it was more than a double whammy. It was like a fucking quintuple hit to the fucking brain of bad way of doing things, essentially. Anyways, after enough time, I hope to be in a better place, not just mentally and physically, but spiritually and emotionally, and hopefully. In reality, I hope to feel as though I am where I belong, or am needed, and loved, and respected. Alright. I think that's about it.